Hello and welcome to Rajya Sabha Television. This special presentation that is COVID-19 India Fights Back. I'm Vishal Dahiya, and in this particular show, we bring you various technological interventions which are helping us to win this fight against COVID-19. In this episode, we will talk about several testing technologies, the kind of testing kits which are there, how do they work, as well as the strategy and the guidelines for testing of COVID-19 by the Government of India, by ICMR, and the rationale behind these guidelines and this particular strategy. We're joined by a distinguished panel of guests from across the country, from Pune, from Thiruvananthapuram, and from Delhi as well. Let me first introduce these guests to you, beginning with Dr. Tarun Bhatnagar. He is a scientist with the ICMR who deals with the testing technologies and various testing kits. Then we also have with us Dr. Gautam. He is the Director of Medical Affairs for MyLab in Pune. Now, MyLab is a company which has come up with a testing kit for COVID-19. And we're also joined by Mr. Ranjit MC. He is the Senior Manager with HLL Lifecare, a PSU, which again is engaged in going ahead and developing or rather manufacturing the COVID-19 testing kits. So let's begin the show, and let's begin it by asking Dr. Bhatnagar specifically about what are the kind of testing kits which are there, which are available, and what is the technology in those testing kits which is being used to find out whether a particular person is COVID positive or COVID negative. Dr. Bhatnagar?
Thanks for having me on the panel. So as you mentioned, we have two kinds of tests that are available today. One is the RT-PCR test, and the other is what is called as the antibody test. So the RT-PCR tests are also called as molecular tests. And why they're called molecular is because what they detect is the RNA in the virus. Whereas the antibody tests are known as serological tests. And what they detect is the presence of antibodies in the virus that are developed in response to the infection that a person would have. These antibodies are developed pretty late in the time, probably 7 to 10 days after somebody gets infected. And there are two types of antibodies that are generated, which is called IgM and IgG. Mm-hmm. So the RT-PCR test, which detects the RNA of the virus, comes positive early in the stage of infection. So when a person is symptomatic and he's in the early phase, within a week of the infection, if you do an RT-PCR test, that person would come out to be positive. Whereas if it's done late in the course of infection, after 10 to 14 days, then the likelihood of the RT-PCR test coming positive decreases substantially. On the other hand, the antibody tests become positive only late in the infection. So the antibodies take time to develop when a person gets infected. So probably after 7 to 10 days of infection, we'll start detecting antibodies. And so if you do an antibody test, you could detect these antibodies later in the stage of infection. And what they would suggest is that if the antibody test is positive, either the person is sort of in the middle of the infection where he's probably still infected, assuming that he's also PCR positive. And if the person has antibodies positive, whereas the PCR is negative, what that means that individual is actually late in the course of infection and is probably had an infection in the past and is likely to be recovering from the infection.
Dr. Bhatnagar, one important question here is that what is the difference between the efficacy or the efficiency of these two particular tests, that is the antibody tests and the RT-PCR test, and also the time it takes, is there a difference as to in how much time the results can be known for these particular tests?
So in terms of diagnosis of COVID infection, what we can use right now is only the RT-PCR test, which detects the RNA of the virus. We cannot use the antibody test for diagnosing a person to be infected with and to treat that person, because the antibodies, as I mentioned, could be positive in the middle of the infection or in the late stage of the infection. So it's not useful for diagnosis purposes. However, the PCR test, once it's done, from sample collection to doing the test and getting the results, it takes about 5 to 6 hours or so for one run of the PCR. Whereas the antibody kits, which are also now famously known as rapid kits, can give you results within 10 to 30 minutes, depending on which company's kits they are.
Mm-hmm.
And the antibodies is better used for epidemiological studies rather than for diagnosing infections.
Let's bring in Mr. Ranjit MC here from the HLL Lifecare Limited. Mr. Ranjit, one very important aspect which we would want to know, since your company is started manufacturing the COVID testing kits. So how and why did you guys come about to do this? Yes, you do manufacture a lot of other testing kits as well, but how about the COVID testing kits?
Yeah, as I explained, HLL is a Government of India organization, and we are in the healthcare sector for last 53 years. And this rapid diagnostic kit manufacturing, we have a facility in Managar. So there we used to manufacture various rapid kits, including the pregnancy detection kits for malaria, kits for dengue, hepatitis B. And during this COVID-19 outbreak, when this ICMR has decided to use antibody-based rapid kit for the large-scale screening of the population, then we explored the possibility for manufacturing this COVID-19 IgM-IgG-based rapid antibody kit. And we made our facilities ready, and the manufacturing activities were initiated, and the trial batches were produced, which sent to NIB and ICMR for validation. And it is validated, and we got the approval. Subsequently, we submitted the manufacturing license to TDSE or DCG, and we got the license. We are now in the process of manufacturing. And in the coming days, we are going to supply the rapid kits to ICMR.
So we're also joined by Dr. Wankhede. He's the director of medical affairs in MyLab, which is an Indian company which has manufactured COVID-19 testing kit. Dr. Wankhede, specifically, let's begin with the kind of testing kit which you guys have developed, and how did you come about to go ahead and do this particular thing?
Hello, Vishal. First of all, thank you for inviting me here. So the kit that we were talking about right now is a real-time PCR, or as Dr. Bhatnagar was just talking about, it's a molecular diagnostic kit. So this is a kit which is targeting a particular gene sequence specific to this particular strain of virus which is causing the pandemic across the globe. So the way we developed and went about going about developing this kit was that the genome strain of this particular virus was made public at the end of January. And our team then started developing probes and primers, the specific chemicals which go and bind to this particular strain of virus. And that's how we came up with the initial kit. We validated it internally. And once we were confident about the quality of the kit, we approached the ICMR for evaluations. Once we got the proper evaluation done, we then went to the CDSCO, gave them the report. ICMR obviously got this report from the NIV lab. And based on that, CDSCO gave us what is known as a manufacturing license, a license to commercially manufacture these kits and then supply them to the various labs of the country.
Okay. How easy or how difficult was it for you guys to go ahead and do this kind of research and, come up to the final product? And is it in the, manufacturing stage right now? If not, then how much time it might take, or how many of them are you making? What is the order which you guys have got?
Right. So as far as the first question is concerned, how easy or how difficult it was? See, we as a company, MyLab Discovery is a fairly old, when I say in terms of old, it's a 2 or 3 year old company. We are into molecular diagnostic kits. We manufacture a lot of molecular diagnostic kits for hepatitis B, HIV, hepatitis C. We are the first company of Asia to have developed and commercialized, blood bank NAT, a screening test for blood donors. So in that sense, we have a well-established protocol. We have a manufacturing facility, an R&D facility in Pune, a manufacturing facility in Lonavala. So we had the expertise, we had the know-how. Once we knew the strain which we had to target, a team of scientists, which are about 8 to 10 of them, started. They worked very hard for a period of 6 to 8 weeks. When I say 6 to 8 weeks, that's in terms of days, but they were working for 12 to 18 hours a day. So they really put in a big effort, ensured that we reached the kind of quality that we were hoping to get. And that's how we got the license. Now coming to the second part, since we got the manufacturing license, which was somewhere, I think, 23rd or 24th of March, since then we have gone into full-fledged manufacturing. We have supplied a large number of kits to various labs across the country. A lot of chief ministers, a lot of people have thanked us publicly for the work we've done. Our current capacity is about 12 to 15,000 tests a day, and we are working very hard, to increase it. Hopefully, take it to 30, 40, maybe a lakh kits tests a day is what we are hoping to reach at some stage very soon.
Okay. So, Dr. Bhatnagar, as we've heard both the representatives from the public sector and private sector companies, and we are aware, we've seen it clearly that both these set of companies are working shoulder to shoulder in this time of crisis. What are your thoughts and views on the quality and quantity of the testing kits produced by these companies?
Yeah, so I think the testing numbers have definitely been increasing since the labs were initiated for testing. There were initially around 60 labs which were part of the ICMR and Department of Health Research Viral Research Diagnostic Lab Network, which were ready to go at the go. And then slowly, as the resources became available, as more labs came into the picture, the number of tests have been increasing regularly. So now we have nearly 233 labs which are doing the tests, of which around 166 are government labs and another 67 are private labs. So the capacity for doing these molecular tests is on the rise, and now even we'll have a plan for even including a lot of the medical colleges which have the capacity to do RT-PCR tests and which can follow the biosafety precautions to be added onto this network of labs which will be doing the testing. Simultaneously, the testing strategy and the guidelines have been evolving as we are seeing how the epidemic is evolving in the country. So initially, it was the testing was done only for those who were either returning from foreign travel or who had come in contact from those individuals who had returned from foreign travel and the healthcare workers. And over time, as we saw that the number of the travel reduced, but the contact tracing improved. And so more and more contacts were started to be tested. There was this issue of how much the epidemic is spreading in the country. Is it limited to a particular group of people or is it widespread? And so ICMR introduced testing of what is known as SARI patients, the patients who are hospitalized with severe acute respiratory infections, which is like a sentinel surveillance, as I say, which gives you an idea that if you find a lot of patients, severe patients hospitalized with acute respiratory illness to be positive for COVID-19, it shows that yes, the infection is probably widespread in the area and the groundwork has to be increased. Subsequently, now with the addition of, as the teams have started detecting hotspots, areas where you see a lot of clusters of cases, and then the rapid antibody kits were brought into picture to improve the testing numbers and to help in a quick understanding of what's happening in the community. So in the hotspots or clusters, as identified by the ministry teams, now the strategy is that all those who have even mild symptoms of fever and cough and sore throat, and so there is a two-step strategy. One is that if we are able to detect them within 7 days of these symptoms, then the strategy is to do a PCR test, because that's the one that will detect early in the course of infection. Whereas if those who have a longer duration of illness, an antibody test is being prescribed to be done initially. If the antibodies are found to be positive, it means that, which is still inconclusive, but it means that they are in a later stage of infection. If the antibody tests come out to be negative, that definitely needs to be confirmed by an RT-PCR test again.
Okay. One more strategy and the guidelines which have come from the government from time to time on this particular aspect. Are there any plans in consideration as of now to move the testing beyond the hotspots to other areas as well?
Yeah, so there are discussions right now to actually do what are called epidemiological studies or surveillance studies, to go actually into the community level and to do rapid surveys at a household level, to using the rapid antibody tests to detect whether people have had exposure to the virus or not. So these rapid surveys across all districts of the country would help us to understand that could there be areas where people may have had been infected but were not caught early in the course of infection, or maybe a lot of them are asymptomatic and hence were not caught into the current testing strategy. So there is a plan that's being developed to actually do rapid district level surveys to detect whether there is infection present in other areas, especially in areas where we are not detecting any cases as of now.
Nagar has explained in detail about the testing strategy or the guidelines. So in terms of where we stand for this particular crisis, the COVID-19 pandemic, and the kind of strategy which we are following, as a professional, as somebody who's been involved with manufacturing testing kits as well of the entire technology, know-how of the entire technology, what the strategy which we are adopting, is that sufficient, or we need to go ahead and make some changes here?
See, Vishal, it's an evolving situation. We are learning every day as we go ahead. So I think the current strategy of a mixture of real-time PCR, which are done at specialized labs, and the rapid tests or the antibody tests, which can be carried out in the field by fairly untrained staff, a mixture of these two tests is a great strategy to begin with. Because as Dr. Bhatnagar pointed out, there is one aspect of finding out someone who's currently infected, and then there's always the idea of finding out people who are infected in the past. So it's a good strategy. I think it's adopted by a large number of countries now across the globe. This will ensure that a large number of people are tested, and we follow that the policy of tracing, testing, and treatment, the three T's as we call it. So we can expand this 3T facility to a large number of citizens across the country.
Okay, since all of you are sitting in different places in the country, you're there in Pune, Dr. Bhatnagar here is in Delhi, and Mr. Ranjit is there in Tarun. Mr. Ranjit, your views on this aspect, specifically if you look at the ground situation there?
Yeah, I also totally agree with Mr. Bhatnagar and Mr. Wankhede. The mix-up of both the tests, that is RT-PCR and antibody capture assay. And we understood that ICMR is coming out with a new strategy, how to use these kits, even these antibody kits also. We believe that it will be managed to ICMR. ICMR is planning to procure the kits, and it will be used for the spot locations, spots, and accordingly the easy diagnosis can be made and the prevention strategies can be formulated. So that's the way the mix-up of the strategy proposed will be the best option.
Dr. Bhatnagar, once again. Dr. Bhatnagar, from the point of view of containing the spread of COVID-19, what is our position right now? Have we managed to go ahead and stop this pandemic from moving to the next stage, that is the community spread? Okay.
Right. I mean, in the sense that the stage, it's better to define the stage at which an area is instead of a country level. What we need to actually do is go even at the district or even sub-district. Because the strategy that we would have, it's difficult to have we need to have localized strategies at district level. And then if we have the SARI surveillance, once the zero surveys start, we'll get definitely a much better picture of what the epidemiology of the infection and the spread is in different parts of the country. And then accordingly, it would be prudent to label specific areas in terms of how much the spread is, rather than labeling the entire country or even the entire state for that matter.
Okay, and in terms of testing kits, it's not only the Indian companies, but we are also sourcing testing kits from outside. If I'm right, then we're getting testing kits from countries like China and South Korea as well.
Yeah, and there's a strong. I mean, initially there were the RT-PCR kits were not available from the Indian companies, and they were only available from the foreign companies. There was a strict quality control measure to make sure that the kits that we're getting are of good quality. So those kits that were either US FDA approved or approved by the European Union, the EC/IVD, only those kits were allowed to be used initially. And then subsequently, when the NIV, the National Institute of Virology lab, was put with this for validating any other kits that came either made in country or even foreign, who were not approved by these other agencies. So now, as you see, we have a few of the Indian players also coming into play, and we hope that we can, with time progression, we'll have more of these which are much cheaper and easily available, rather than the foreign kits where, again, the regulatory requirements, the travel time, and all those have been some bottlenecks in expanding the testing strategy
I would like to request you to explain to us once again the entire concept of the testing for COVID-19 as to what is the procedure, how much time does it take for the test to take place and for the results to come through.
So for the diagnosis of the test, which is still done by the RT-PCR test, the molecular test, we take the samples, the respiratory secretion samples. The ideal is to take a nasopharyngeal sample, but then it's easier to take a throat swab. So a nasal swab or a throat swab is taken, and then that's the swabs are put into what is called as a viral transport medium, and which is then transported to the labs. Subsequent to reaching to the labs, they would be put into the testing kits. And so the overall, I mean, once it reaches the lab, it would take maybe around roughly 5 to 6 hours for the entire batch processing to happen and then the results to be out.
We have different kind of testing kits, the ones manufactured by companies like yours and the ones produced by PSUs like HLL Lifecare Limited. And we're also importing testing kits from several countries. And we had to begin with specifically the RT-PCR kits. So in terms of cost analysis, are the kits produced by you or other Indian companies here indigenously cheaper, or they would be costlier than what we are getting from outside?
See, definitely the idea of manufacturing anything in India, not only the RT-PCR kit, and it applies to everything, is number one, to reduce dependency on foreign players. Number two, obviously, once you manufacture it locally, you reduce the freight cost, you reduce the labor cost of a foreign manufactured kit. So obviously, our target is to provide large number of kits at a very, very cost-effective rates. It will be difficult for me to compare what our kits compare as to what foreign manufactured kits are. But as a philosophy of the company is to provide large number of kits at a very, very cost-effective rates to the lab citizens in India.
There it is, as has been explained by our panelists, the entire concept of testing technologies for COVID-19, the kind of kits which are available there, how Indian companies are going ahead and putting their best foot forward in trying to ensure that the demand for these testing kits is met. Also, the rationale behind testing strategies and the guidelines which have come from time to time from the government. As our panelists have pointed out, there's nothing to worry about. There are enough sufficient testing kits available, and the government is working on guidelines based on the dynamic situation, which keeps on changing from day to day. We'll come back again tomorrow with a different topic. Till then, keep watching Rajya Sabha Television. Also, follow all the government guidelines as far as lockdown is concerned. Stay home, stay safe.